spinatus, acromion process. Follow the spine of the scapula to the medial border. Just come above that and then press down. And then from there, what Mayumi is going to try and do from there is very gently just to try and push me over with the hand. So from there, if I step away, what Mayumi is doing is just lifting the arm out to the side. And again, just nice and gently. Supraspinatus. From the acromion process, follow the spine of the scapula to the medial border. Just come above that and then press down towards their feet. And as they lift their arm out to the side, then they will activate the muscle. Infraspinatus, the medial border of the scapula, the lateral border of the scapula, spine of the scapula in that triangular area, finger into the belly from there, and then all you need to do from that position there is ask them to put their palm down, keep the little finger onto the table, turn so that the thumb is going up towards the ceiling. Lateral rotation. Again, medial border, lateral border, spine of the scapula, into the belly of that muscle. Thumb is down. They keep the little finger down and turn so that the thumb is coming up towards the ceiling. Lateral rotation. Infraspinatus. We've already located the posterior deltoid, armpit, shoulder, halfway. If we just get them to lift the elbow up towards the ceiling, feel for the border of the posterior deltoid. They can now put their arm down, but we've got to try and get underneath the deltoid and push, as if you're pushing across towards the ear on the opposite side. So you're pushing towards the lateral border of the scapula, and all that Mayumi is going to try and do is to bring the forearm up. So there's no movement of the upper arm, either away or off the table. It's just the forearm that's working to do that. So just bring the forearm up again, and down, and just lift it down just a fraction, and again. And that's lateral rotation. So infraspinatus, teres minor, both do lateral rotation. And teres major is not always included as part of the rotator cuff muscles, but teres major is just along the lateral border, and then from there, very gently, my thigh is against the elbow. What Mayumi is going to try and do is with her elbow just try and push me over, and then this muscle just jumps up. Teres major. Supraspinatus, infraspinatus, teres minor, teres major. So the one that we need to try and get to now is sub. Now, in order to find subscapularis from this position here, what we're going to ask Mayumi to do is to slide with the shoulder coming off the edge of the table, and the feet across towards the opposite side so they don't fall off. And then from here, you're going to lift that up and then try and get underneath so you're not going to invade rest area, and then slide that right across. This hand here is bringing across. The bottom hand is trying to push in as far as you can. Once you get in as far as you can, then you go really deep inside there and just curl your fingers up towards the ceiling. So lift up, underneath, and curl up. All that happens now, Mayumi is just very gently just going to turn that in, and it can be really painful. So it's the medial rotation that creates the problem. So from there, okay, away we go. Nice and easy, careful. That's the idea. And then as we go, each time you can move this hand that's underneath to a different position to get to the subscapularis. Subscapularis is the major medial rotator. Lift that underneath the scapula, so you're on the front of the scapula. trying to abduct as much as you can and push in as far as you can with the lower hand. Curl your fingers and they do medial rotation. So if they do this really quickly, it's going to hurt them, that's their problem. Really nice and easy. So you advise them slowly, slowly, slowly. Subscapularis. Supraspinatus, chromium process. Follow the spine of the scapula to the medial border. Just come a little bit above that. Press down. Stabilize their arm, because what Quinn's going to do now is try and lift the arm out to the side, and that will activate the supraspinatus. And then what we might do from here is use both thumbs, and so from that particular angle there, it's just a matter of just rolling the thumbs. And it's this part here that's just rolling in. So from there, press and roll. So you're trying to squash supraspinatus into the supraspinatus fossa. And be aware that it might be sore, so just take it easy. So that's underneath the great big muscle mass of the upper trapezius. Onto the infraspinatus, step the head, the muscle fibers will be coming across that direction. Now you need to be careful, because some people, it's really sore in the midpoint here. So just do some dry massage. Do some compressions and do some make happies. So the muscle fibers are coming from the medial border and they're coming out towards the posterior part of the humerus. Stand at the head. And the reason for standing at the head is that if we do come down from this angle and go upwards, sometimes there's quite a sharp edge onto the inferior lip of the scapula, and that gets caught underneath there and it can be quite sore. So if you come from the head and just sandpaper down there, be really careful, because some people are very sore about the midpoint. Impressions, and then some make happies. Vibration. If we take the arm out and either put that down by the side, or if you prefer to leave the arm on the table, provided they don't have a problem with their shoulder, then teres major, teres minor is in this area here. And what we're going to try and do from there is to get that thumb to go right up underneath. Just be aware that they might be ticklish. Keep the fingers nice and flat and just come backwards. Don't try and grab with the fingers, that will hurt. And so from here, and just try and make a little arc with the fingers. And depending on the size of the scapula, it depends on how many different positions you move to. If you find that that's awkward, then from there onto the edge, all fingers are closed up, the flat part of the fingers, and just sandpaper. Onto the lateral border of the scapula. Compressions and some make happies. For subscapularis, because that's on the anterior part, then from here, what we're going to do is to put the fingers underneath. The thumb is the focal point, and the thumb is basically going to go up towards the nose. Pull on the arm to try and pull the scapula away from the vertebral column, and then from there, once you've gone in, the thumb goes down. Go in. Now be careful, this can be really sore. And then from there, what you need to be looking at from there is, if you can see the fingers, then from there, Quinn does medial rotation, so he's turned the humerus down towards the feet. And then once you've done that, the thumb then, if you can imagine, there's the subscapularis muscle, the thumb then moves to different positions, and one of them is likely to be really, really sore.